Dr. Aarti Bellari. We have been talking about multiple health topics in the last few weeks. Today being World Hypertension Day, we'll talk something about high blood pressure, that is hypertension. It is one of the most common non-communicable diseases along with high sugars, that is diabetes, high cholesterol, metabolic syndrome. It comes into the same spectrum, that is high blood pressure. Why knowing about hypertension is very important? Because first thing, it's a silent killer. That is, you may not have any symptoms until you develop with an end organ damage, until you develop a stroke or a bleeding into your brain, or develop an organ damage, that is damaging your eyes or kidneys. Since it's a silent killer, you may not have any symptoms at all. So most of the times when you don't develop symptoms, we don't go to the doctor, we don't check it. But many a times it's very, very important that you check your blood pressure regularly so that we monitor that and take appropriate actions if it is very high. Or if it remains high, you may need medications basically to reduce it, and therefore there's no organ damage. Now, what is many a time people think that I have anger issues, I'm angry, therefore I get high blood pressure, otherwise I'm okay. So there are multiple excuses people give for their high blood pressures, but just being angry doesn't mean you have high BP, or if you're not angry doesn't mean you don't have high BP. So this is something which your doctor or clinician will examine you, check your blood pressure and tell you whether you belong to the category of having high blood pressure or not. So basically, nowadays there are multiple ways you can check your blood pressure. There are home BP devices which are available, which you can use and monitor your blood pressure. So what is it, when do you label somebody hypertension? A lot of people go on to say, it's been 150, 90 for the last 2-3 years. That's normal for me. Obviously, that is not normal. A lot of people have this myth that, it is normal, but it's not so. Any blood pressure where the systolic blood pressure goes above 120 and diastolic blood pressures are more than 80 is considered hypertension. Of course, there is grading which your doctor will tell you, grade 1, grade 2, grade 3 based on your hypertension. And just based on one reading, your doctor will not diagnose you to have hypertension, but yes, they will take readings which you do it at home. Then they will check your blood pressure on every visit, maybe 2 to 3 times in a month, and then make a call whether you really need medications or not. So first thing I told you, it's a silent killer. So unless you check, you don't know whether you have high blood pressure or not. And second thing, to monitor is to go to the doctor. They will check your blood pressure, and also they'll assess other risk factors which are there and maybe take action based on those risk factors as well. And what about, lot of them now come with home BP machines. They are confused. There are multiple options available. If you check on various shopping sites, they ask whether it's good or not, whether it's reliable. Most of the modern machines which are available in the market are quite reliable, and you may sometimes need to bring it to your doctor's office so that they can calibrate if necessary, and changing their batteries regularly. And if you take appropriate action, the home BP monitoring machines, the automated ones, are as good as the manual BP machines as well. Unless you find too much of fluctuation, that needs to be evaluated by your doctor. Only step which you need to take care is the BP cuff, which needs to be tied correctly to the arm. It should rest well. If done in a proper method, the home BP readings are extremely useful. So once you check your blood pressure and found to be high, then appropriate medications will be started and lifestyle measures need to be implemented. What are the simple lifestyle measures that you can do to keep your BP under control? First and foremost is salt-restricted diet. Many people are salt sensitive. Once they started on medications and they cut down on their salt, their BP is very well controlled. So salt-restricted diet. Second thing being good lifestyle changes, that is brisk walking, running, or choosing any form of sport, basically including physical activity and keeping your weight under normal range. all these simple measures are good, not just for hypertension, it's good for even diabetes and other metabolic disorders. And most importantly, doing physical activity is extremely nice for your mental health. It keeps you healthy, agile, and brisk. I would just urge one thing, that is, know your numbers. Know your numbers. Check your blood pressure. That way we know whether you are hypertensive or not. It's most important to know your numbers. Make sure you go pay a visit to your physician, check your blood pressure, or do a home measurement reading. If you need our help and guidance, we are there here to help you out. Reach me out with your queries. So for the World Hypertension Day, let's measure our BP accurately and control it and live longer.